Hello, everyone, and thanks for joining us for today's webinar. My name is Donna Chow, and I'm your host and your moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is Understanding Jimmy Chang's Clinically Proven Formulas, Part 2, presented by the Master Herbalist himself, Dr. Jimmy Chang. Before we begin, I'd like to go over a few items to familiarize you with our webinars and how they work. Today's webinar will be from 2:30 to 4:30 p.m. Pacific Time, and we will have one break. Dr. Chang will let you know when we're having our break. For lecture notes, please download them directly from the Blue Course Access page in your eLotus account. And to use the webinar chat room, please set your chat preference to everyone so that everyone can see what you're typing and be part of the conversation. And you can go ahead and do this right now. By default, Zoom just has it where the chat is sent to the host, which is the eLotus staff and Dr. Chang. But we want everyone to be part of the conversation, as I mentioned. So please, again, set your preference to everyone. And to ask Dr. Chang a question, you can go ahead and enter your question into the Q&A box. And if time allows, Dr. Chang will respond to them accordingly. And finally, the quiz and the video replay, you will be notified by email tomorrow once they are available. So our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in differential diagnosis and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang, the master of herbology, as he explores the art and science of his unique herbal combinations. You will learn about a range of herbs for breaking up masses, stop bleeding, and also his special formulas for skin disorders. You'll also learn the pulse indications associated with specific conditions and how to prescribe a unique herbal formula for your patient. Dr. Chang has previously taught numerous courses with us, which is now available for purchase as distant learning CEU videos. Dr. Chang is the person to learn from if you want to be able to feel your patient's pulse and be able to identify the Western medical diagnosis and come up with your clinically effective herbal formulas. If you want to cultivate your pulse diagnostic and herbal skills, he is the person to learn from. I recommend the Gold Pass for learning his pulse system. You have unlimited access for a year to his pulse courses and herbs. And with the Gold Pass, you can also try the herbs that he mentions, since our sponsor, Evergreen Herbs, will give you a voucher for herbs. When I return to my computer, I will post the link so you can read more about it. All right, so let's get started with today's class and begin, and welcome Dr. Jimmy Chang.
Hi guys, it's me again, Dr. Jimmy Chan. I'm here to talk about something very interesting. Hello. Okay. Today we're gonna talk about three breakers and one lump combo, which is very, very interesting. And I'm sure you can use it exactly the same thing here. Starting from tomorrow morning with all your patients will be very happy. Okay, now let's get on with it. We call this mass breaking formulas and some pulse science. Actually, I'm making it a lot easier for you. Even you are not very familiar with my pulse science, but you can see from here, you can do anything you want. Okay, let's get started, huh? Okay, see the ear signs? There's a lot of things in there to say. Let me do this for you. Okay. Now you see, this is the stomach area. See the black spot there? If the patient's demand is for treating his stomach problem, you might want to use my code breaker. or lump special. I mean, lump combo. See this one? This is the gallbladder. So if you want to treat, if the patient demands you to treat his the pain on the right hand side on the rib, the gallbladder area, you can use my cold breaker because it's cold, it's white. And see this one? This is the thyroid area. Thyroid and it's black, it's dark. So we might use my lump combo for the thyroid part. See here, the redness in the head, that's the redness means inflammation. So if you want, if the patient demands one, you treat his headaches or something, then you can use the my hot breaker. And see this one? For men, this is the testicle. So if the patient's major complaint is the pain in the abdominal area, you might use my lump combo to destroy that stuff. And so is here. This is all these are the testicle area. This is above the testicle. This is on the testicle. Or if for women, this is the ovary. There's a lump above the ovary, and this is the lump of black spot. The blood stagnation is on the ovary, can be caused from previous operation or abortion or whatever in that. We can treat it with my cyst breaker or lump special, whatever. And see the darkness here, that's the hip. So if the major complaint of the patient's pain is the back pain, so we use cold breaker to deal with the darkness. But now this area is the hip, that means inflammation. So you might want to do something about it with my hot breaker. Try to remember the two words. Huh? One is for inflammation, one is not. Okay, see this one? This could be the duodenum or just stomach itself. It's red, so we use hot breaker for all the different kind of discomfort in the stomach area. Huh? Oh, this, by the way, this black spot is we call inner ear, which might cause dizziness or something. See this one? That's the knee joints. It's purple. So sometimes we use something blood movers like 生痛足鱼汤 or 正骨紫金丹 or my breakers. Hey, hold on. How to go back? Oh. Okay. You see, this area. See this area? That's a hemorrhoid. And it's dark. That means the blood is stuck in there. So you might use my cold breaker to destroy that, to get rid of all the symptoms. So see, a simple ear can show you so many different conditions. And we have all the herbal formula, my breakers to deal with that. So it's gonna be very, very interesting today, okay? Any questions so far? Nope. So even you are not familiar with my pulse signs, then you can just watch the ear. This is so clear. It take only 5 minutes to be able to do that. See this area? See this? There's got to be some scar caused by previous ulcer or something in the stomach. If it causes pain, then you use my breaker. It will cure it right away. Okay. No questions so far? Okay, next one. Okay, we'll be talking about 3 breakers: cold breaker, hot breaker, and cyst breaker, and lump combo. And we'll be talking about psoriasis and the skin combo, and stomach combo, and black one, which is very useful in your daily practice. There's no doubt of it. Everybody will encounter a condition like that every day, which after today's seminar, you'll be able to deal with all those very difficult to treat problems. Trust me, it's very worthwhile. Okay, let's begin. Okay, first one is the code breaker. The name code breaker, I don't know who gave the name, me? I don't remember. But anyway, it's supposed to deal with all the cold or stagnation condition, which means there's no inflammation. So how do you know if the guy has inflammation or not? By taking the pulse. If the pulse is very jumpy, then there's got to be some inflammation in there. If the pulse is so dead, the amplitude is low and not working properly, then we'll be able to know that's the code breaker. I seems to be forgetting something. So is Tina supposed to say something before? Nothing? Okay. So what a code breaking is for any mass that is cold in nature. Cold also combined with stagnation. So you can see in the previous year, all those dark spots are cold. Then in the ingredients, it's like this: 山林而足 and 王不留行. Don't use it for any possible pregnant lady. Huh? These two together, Tina asked me, why are you using it, this 山林而足? Because I told her that there's got to be some kind of a lump or swollen tissues, old trauma or injury caused by anything, not only in the bone or structure area, can be in the inner organ like the stomach, like lung, like chest, like the ovary, in the gallbladder, in the kidneys, or sometimes in the liver, and mostly in the gallbladder, can be anywhere. Sometimes we cannot see it. We do not see it on the ears, or we do not see it on the pulse, but we still feel that I still believe there's something like that. So that's why I designed this to destroy that. And even you're not too sure about it, you can directly use it. %, this two combination for all kind of pulse, like the pulse. Okay, this is 寸关尺. The pulse, it can be, the lump can be here, can be between 寸 and 关, can be between 关 and 尺, and which is normally, I mean, is very commonly seen here, and can be here. This can be left-hand side or right-hand side, all possible. So, like I said, my pulse diagnosis, the biggest my system, between my system and the very ancient pulse system, like in your textbook, is the positioning, the hand method. My 寸关尺 is not on the high bone of the wrist. Like in your textbook, they said they want you to put your middle finger on the high bone, and that is wrong. I do not know why, but I learned it from my patients. Mine is more accurate. It's the only thing that accurate. So a lot of people, when I was in Taiwan, they don't believe in pulse diagnosis because they use the pulse skill from the textbook. It didn't work. It never worked. Mine works all the time. So, like I said, when you learn my pulse science, make sure you put the finger in your right position. Use the high bone here, put between your first finger and second finger. And you will see something on the 寸 maybe, and something in between 寸 and 关. Something if the stomach is no good, you might see something in the stomach. There's a lump in there. And you can verify your pulse finding by the ear point. Ear point can be more easier and more direct. And mostly you will see a lump between 关 and 尺. And sometimes maybe you even see something under your third finger, the 尺. So the lump can be anywhere. And as for now, let me remind you a very, very important skill of taking pulse diagnosis is that After taking the pulse with your finger bed and use your fingertips to feel the pulse, you will only find the short pulse that we call a short pulse. That means lump there from your fingertips. Otherwise, you can never find it. And as for the jump, the force of the pulse, if it jumps very strong against your fingertips, then it must be fire. If the amplitude up and down is very limited, it doesn't jump really much, then it's stagnation. Then use my different lump breaker or cold breaker, hot breaker to deal with it. Huh? Okay, any questions so far? Would you recommend that we should take cold break once in a while? Huh? Oh, sorry.
Okay, Zhang Yizi.
Hi.
Hi, everybody. I will be the representative to ask questions. I'll start first, so you guys can feel free to type into the Q&A. Don't be shy to ask questions. Dr. Chang is excellent at answering all our questions. Sometimes he'll call us stupid, but don't mind that, okay? Just keep asking. Dr. Chang, before we go on, can you explain first what exactly do you mean by mass? Because I think it's a little bit misleading, or maybe my understanding of, this group of herbs that you're using now, for mass, lump, cyst, is really not like what we think about, like fibroids or, cysts. It also includes, like you said, swollen tissue, right?
I didn't use the word mass, you did.
Yeah, I know. So it's probably my misunderstanding. When you want to break something, like for example, this cold breaker, we're breaking up some sort of stagnation, some lump, some swollen tissue, some cyst, right?
Oh yeah, all of them.
And past like trauma and scars, that's all included, correct? Or
of
no?
course.
Yes. Okay. So for example, you said swollen tissue now.
Yeah.
Does like a swollen tonsil, is that a swollen tissue that you can use? Okay. So for example, let's keep with this topic, okay, the swollen tonsils. Would you use a breaker, or would you use the astringent complex? Last week we talked about reducing the inflammation.
We destroy that first.
Which one?
We destroy the lump first.
Destroy the lump first and then reduce the inflammation later.
Yeah.
Okay. So another question.
Or you can use them together.
Use them together. Okay.
Yeah.
Use them together is even better. So the idea is, everybody, that we're not really treating actually something that is, not supposed to be there, like any kind of mass. It could be, again, your existing organ that is swollen, or any kind of lump or cyst that's extra growth, and any kind of past trauma, like he was talking about on the ear. Remember just earlier on, any brown spots, all those scar tissues from past surgeries. So if what you're looking for is pretty much on the pulse, you're looking for a convex, like bulging pulse. And if that pulse is forceful, then you know that there's heat along with the whatever that is, this mass, let's call it. And then you would use the hot breaker because it's the hot condition. But if it's like a lump, but then there's not much pulse to it, not much strength to it, you use the cold breaker, this one that he's talking about. And if you cannot figure that out on the pulse, you can just go to the ear, right? Dr. Chang was showing us the ear just earlier on, that little white spot on the ear, that's a cold mass because it's white. But if it looks red, then okay, then, you're dealing with a red lump. I mean, an inflamed lump, something swollen. And if it's brown, then, I guess it could be either hot or cold, right? If it's brown, Dr. Chang, most likely cold.
Yeah.
Because it's been there for a long time, blood stagnation. Okay, so I hope that clarifies a little bit. And one more question, Dr. Chang, I have for you. When we talk about masses, any kind of extra growth, in Chinese medicine, we learn, okay, it could be a blood stagnation mass, or it could be like due to phlegm and damp, right?
Yeah.
So do you care about that, or do you usually just care about, it's cold or hot? Because you just break it all away.
Just use them all together. Don't think that much.
So that answers my question. So for you guys too. So don't worry about it's phlegm, it's predominantly blood stasis or whatever, just break it all up and make sure the temperature is correct. The herbs that you choose is either cold or hot.
the things we're talking about here is very theoretically and ideally.
Right.
Actually, the human body is very complicated.
Right.
So you can use them in both at the same time.
Right.
Okay,
So
let me answer the question.
Okay.
First one, would you recommend that we should take some cold breaker once in a while, just in case we have an injury? Yes, of course. How often and how much? How should I know that? It's your personal condition. You just use it. Second one, do you need to add some guide like a 阁下足鱼汤 or 血府中? Yes, why not? Wouldn't swallowed tissue be hot? Mostly, yes. I would have thought for swollen inflammation, we will use heartbreaker instead of COVID. Of course. Answer, thank you. Okay. Any more questions? Okay. Is this formula for standalone? Would you add herbs for the underlying pattern to locate too? Yeah, sure. So, like I said, you can put them all together. That's what I did. Cold and hot. It happens all the time. Okay. Oh, I haven't finished yet. Okay. As for the 王不流行, this is very strong. This is you can say it's a guide. It's guide or leading ship to take all the bad stuff out of the human body from many openings, like from the urination or from the poo-poo, whatever, but it will not cause any kind of diarrhea or what. 王不流行 is mostly I use for ladies' period, which there hasn't come for quite a while, a few months, something, or for ladies, young ladies with the polycystic syndrome, and all this, or some lady just with some emotional trauma, all the period has stopped for several months. I use that 王不流行. But the reason I'm using it here is because I want to use something to guide all the dirty things out of the lady's body. I use the 王不流行 to clear it, and that's what I use it. Usually you don't really need it for example, a lump in the neck, a lump in the other places. This is for majorly for period wise. Okay.